morning. We are excited today to have another successful leader in our community who is with us. I'm happy to introduce Teresa Toland. She is CEO of TANDEM365, which is a business that didn't exist 10 years ago.
Right.
And we are so excited to learn more about the work that she's doing. She has been a leader in the community, though, for a very long time and has had tremendous impact. So today, as we are sharing and looking at TANDEM365 and her leadership, there will be two parts to our interview. You're going to want to be sure to sign in for both because this is a great opportunity to learn so much. So Teresa, thank you for being here with us.
Oh, sure, of course, and thank you for inviting me. I've known Rhoda for a long time, so
That's
this is
true.
actually for me is a treat to get to sit and talk with you. And we've had many conversations over the years.
We
I
have.
appreciate you so much.
Oh, thank you.
Thank you.
Yeah, it is interesting because you're right, it has spanned some time. And I think for both of us, we've learned a lot on this leadership journey. But I am interested in finding out more about TANDEM365 because I feel like it's such a great resource that many people are not aware of. And so share with us a little bit more about what you do at TANDEM365.
Well, I mean, what I do is I'm the CEO, but that doesn't really equate to what we do in the community every day, which is pretty amazing. As Rhoda alluded to, we're 10 years old, celebrated enrolling our first patient April of this year, 10 years ago in April. So big journey, a lot of different variations of our program considering what we did when we started and where we are today. We serve about 1,400 people across East and West Michigan now, which we're very excited about. Started out only in Kent County and 10 years ago, one county, and now we're in 7. So very exciting what we do. We provide such a great service. It's so hard to summarize it in just a few words, but if I were to try, I would say our biggest goal is taking care of those people with advanced illness that live at home, want to stay at home, most likely. We try to provide services that they are eligible for, that maybe they didn't know they were even eligible for, so providing the information, but also providing the hands-on care as well. So many times I'm living at home, I don't know what my resources are, I don't really have resources. So trying to connect people to the resources is really huge because they exist and many times and nobody really knows how to access those.
Yeah.
So our main goal is let's talk about what the journey's been like for them, what the roadblocks are, the barriers, and try to eliminate as many of those as we can. So we have, our nurses and our social workers, which do phenomenal work. We have medical assistants who help with things like setting up their meds or going to get their meds or, things like that. And then the paramedic service that we have, which is I need help. So I call and we answer the phone 24 hours a day, 7 days a week. Never goes to voicemail ever. It's one of my big pet peeves. So, older adults don't want to get put in a circular rotation about pushing any number to get to anyone. I want to talk to a live person. And we do that 24 hours a day, 7 days a week. And the way that we're able to do that, our office staff are trained to triage calls. So if I call in with what I feel is urgent, we get that to the right place. And sometimes that means we have to send a paramedic to your home to check on you. Make sure that you're okay, determine if you can indeed stay home, and we can do some interventions in the home, which could mean anything like breathing treatments or IV therapy, or it could mean a dressing change. It could be any of those things. When we developed Tandem 10 years ago, our goal was to think about what doesn't exist today in healthcare, how many times everything is restricted to what my insurance will cover, and what co-pays do I have to pay, and so many of the things we do were not reimbursed by insurance. So when we started our journey, it was like, how can we get paid? That was a big thing. And we were very fortunate to be connected to the, Priority Health at that time, in a way that they were very interested in what we were doing. And so they became interested, became kind of a partner in the early days, helped us get started enrolling people that were eligible.
Yes.
And then just kept snowballing into where we are today, with really saving on those unnecessary emergency room visits.
Yes.
Unnecessary hospitalizations, hopefully, because we're involved early. People don't have to go to the hospital. But then also recognizing that sometimes I do need to go. And when do I need to go? Like understanding that even for myself. And then in addition to that, just what other services, how can I stay healthy?
Yeah.
How do I take my meds? How do I take care of myself? And one of the biggest things that people don't understand is social determinants of health. Like now is the buzzword. 10 years ago, we didn't really talk about it, had a formal name, but we knew there were just things that happen in people's lives that made them not really care so much about their health, but instead, how do I pay my electric bill? How do I pay my rent? How do I put a roof over my head? How do I get food? And in Maslow's hierarchy of needs, which we all understand, that's first. I have to have comfort and food, and so that's kind of where we start with people. Like if you don't have that, then you're not going to listen to me talk to you about how to manage my congestive heart failure or any of those things. So we just kind of close the loop on and circle people with all the things they need in terms of like even how to communicate to my physician, how to communicate across all the players in my health plan. Like I may have home care, I might have an aide that comes to visit me, I might have all kinds of people involved in my care, and none of them talk to each other.
Correct.
So our first step is always let's get everybody around it. Let's get on the same page with everybody.
Wow.
So that's a quick snapshot of what we do.
Yes. And that is so critical and important when you talk about all those pieces that have to work together for someone to be well in the most holistic way, right? I think we think about wellness in terms of, am I okay enough to function in my day? But true wellness in terms of our emotional health, our mental health, which is a whole nother piece that gets wrapped into it, I'm sure. And so that has to be a challenge, because when you talk about being available 24/7 and making sure that people are responded to, and then trying to process with people, is there a tension sometimes between, I can imagine, the pace of needing to do all of those things, and then at the same time wanting to make sure that you have the time to spend with people, because when you're not well and you're stressed, I'm sure most people are calling you when they're stressed and not at their best or not able to communicate as well. So what is that like? How do you help your staff with just even balancing that?
Well, that's a really good question, because the staff that we hire, of course, the type of staff that we want is the passionate, compassionate person. And many times you still have to help your staff develop boundaries. Sometimes it's the end of the spectrum on both ends. Like I have the patient who calls too much, the one that is lonely, needs to have conversation and calls the office a lot. And then you have the ones that you wish would call but don't call. So you're trying to figure that out. And the one thing that we talk about a lot and that we learned at the very beginning is the relationship with the patient, participant, member, whatever you want to call them, is the most important part of what we do, because that kind of gets them where they want to call. Like where before I don't trust, no one's ever cared before, why would I call you? Takes time. So we always talk about in the beginning, the care and the delivery of our care is much more concentrated. Like we try to be present, we try to get them to call us first, all those things. And they're not going to do that if we don't somehow demonstrate that we really care and we respond. So they're used to leaving messages at the doctor's offices or leaving messages for people, and no one responds in the way that's timely in their perspective anyway. But we try to do that. Yeah. We try to make it a point that is what we do. And our people that answer the phone in our office are very well trained. Mm-hmm. I mean, they are compassionate, and they do show passion and compassion, and they love their job, and they will, that's the kind of people I want to work for me. Yeah. I want them to be like that. And then we kind of help them sometimes to say, you have to let go. Because there are people who you just can't get engaged the way you want to. And that's the hardest thing for our staff, because they want to keep trying. And sometimes we just have to say, we can't work harder at it than they work. Mm-hmm. As much as we want to, because you're spending all your time on these few patients when you have this many on your caseload.
Right. Yeah. So who normally would refer them to you? Is it an insurance carrier? Is it a doctor's office? Is it a relative? How do people find their way to TANDEM365?
Well, today there's probably a few ways. The most prominent way is we have contracts with the insurance companies, and they refer the patients through a list that we actually get, and then we call people and try to get them enrolled. Okay. We do it through a way that obviously we're partnering with the insurance company, and we do it in a way that's kind of a soft phone call to just say, hey, your insurance company gave us your information, and they're very interested in you participating in this program, which is, very beneficial. We do have doctor's offices call. We have family members call. We are able to do private pay. Okay. So we do the same type of care if it's private pay or referred through an insurance company. Mm-hmm. But most of the time, that's how we get our referrals. They're on an eligibility list, which means they meet criteria of advanced illness. So that advanced illness means I could really use someone to kind of help orchestrate my care.
Do you find also that not only I would think it is a benefit to patients, but also to doctors in terms of having that appropriate interaction and communication, where maybe a patient, when they go to see the doctor, is nervous or confused, or they forget to share certain things, or they don't even know when I should go see my physician because, it'll be all right. I can just wait. I know a number of people like that, and with your help, it seems like it would help them to know when I should go, and then not to forget those things, or to help them be sure to communicate certain things to the doctor.
Oh, sure. There's people who are very well in tune to their medical conditions, and so they also keep their appointments. They go to their doctors. They have a relationship. But there's also those who don't have that relationship, maybe are a little more forgetful or have multiple appointments. And so our goal is to help them with that. And in fact, we go to doctor's appointments with our patients when necessary. If we want to be there to advocate for the patient, we go with them. And that's a good way for us to also introduce ourselves to the physician, so that we look like a team to the patient. We're both there to help orchestrate their care. And that's really important. We found that visiting with the patient at the physician's office helps establish a really strong relationship, and then it's easier for us to engage them in taking their medications correctly, keeping their appointments, understanding the importance of what each physician does, because most patients could have as many as 3, 4, 5 physicians, and they're trying to figure out when I have to see these appointments, why are these important, and also there's duplicate, sometimes medication discussions, and it gets really confusing. So that's kind of what we're there for, is to help simplify it for the patient, so that it doesn't seem so complex.
That's wonderful. I just think this is a resource that our community has really benefited from, and again, has not always been aware of. So we're going to take just a quick break, and then we're going to come back and we're going to talk more about what it means to lead your team in that environment. So stay tuned, and we'll be right back.